I think it's absolutely awesome that everything is in one system. So you log into Better Day and I have my rooming system, I have my medical records, I have my imaging, I'll eventually have my email in there, everything in there. I'll log into one system for the day and I have everything I need.
The main difference between what we used to do and what we do today is the fact that we would do the documentation verbally, have to go back and review it, so we always had to revisit it. And then by the time we revisited it, we always forgot what actually happened. Now we're doing much of the documentation in real time, and if we get crazy in clinic, which happens because of the nature of my practice, then I can still come back at the end of the day and finish it within a day or two. The other thing is that it's extremely quick to do my radiographic reports and my in-office procedures, which often would become very redundant. And because the data is always entered and never replicated, we never have to go back and do that. And so the real tedious things, saying the same things over and over and over, were the things that really wore us out. Even though we would be able to build smart texts and all those sorts of things, we still had to click buttons and go through multiple interfaces to make it happen. The great thing about Better Day is it's one interface. I mean, essentially, you put in the diagnosis, you choose your document skeleton, and then NobleDoc allows you to have one interface to finish everything.
It is so simple to order an x-ray. Also, for referrals, I'm usually sending referrals off the same day that the patients are seen, because everything is real time, everything's dictated right there. It's so simple, so easy, doesn't slow us down in clinic or anything like that. So I'm able to send these referrals off the day of, so the patients are less aggravated. That saved me less phone calls because they would call me every day until I got to send it off, kind of thing, to make sure I didn't forget. So Better Day has saved me tons of time.
Because we're able to integrate virtually every program that we need to with the system, we no longer have to have multiple programs with multiple logins and all those sorts of things. Ultimately, it's going to lead to this clinical operating system that is basically the operating system for the practice of medicine. And we extend that for the practice of medicine and ambulatory clinics ultimately to the entire enterprise. The only system that I know of in the world that's able to capture about 98% of structured data or analyzable data. Because of that, we'll be able to really, really manage our populations well and reduce costs and improve quality. Before, when I was using my antiquated EHR previously, and I was using a Dragon product before, it just really was not as good as I thought it should be. There were multiple issues with it. It was not efficient and was not very accurate. But when I switched to the Better Day product with the embedded nuance product in it, it was amazing how accurate that all of the real-time voice or speech-to-text was. And we'd never seen that accuracy before. So that's part of what allows Better Day to be so quick, because I'm pretty confident that when I speak it, it's going to come out and it's going to be an accurate statement.
Well, and when Better Day first came over here, and the program guys who were awesome were kind of telling me, this is going to be so much easier and stuff. In my head, I'm just all right, it's going to be easy. No, it's literally saved me hours. I'm sure that makes Dr. Noble's checkbook happy as well. He's not paying me overtime anymore. But I mean, it's literally saved me 5-6 hours a week. And just stuff that was so unnecessary that I thought was just normal. You realize now, how crazy is that I had to do that every day whenever we have something like this.
I think Better Day can change people out of that mindset. And I tell them, if you were to just come work with me for a day, you would see how much time you're wasting. Because you really don't know. I got used to just spending an hour a day clicking. I was just used to it. And then now, I'm working less hours and getting more done.
Better Day produces fewer clicks, and that the documentation is essentially one seamless document. I mean, the NobleDoc that Peter Ragusa designed is absolutely brilliant, because we're not clicking in and clicking out of multiple dialog boxes. And it tells us exactly what needs to be finished and what doesn't. So we now no longer have to think about what part needs to be documented. And so I think the thing that I would tell my colleagues is that it's going to change the world. You really have to experience it to understand what I'm saying. It's just one of those things that's so disruptive that you've got to experience it firsthand. And I think you have to use it. You have to see it in the office. You have to see it in real life, because a demo is just not going to do it.